Good day everyone. With the current lecture we'll start discussion of enteric pathogens and the biggest family important in medical practice of Enterobacteria, Enterobacteriaceae, and the first pathogen of that family is an Escherichia genus. The only important species and the only medically significant species is Escherichia coli, or we can call it E. coli. So any Enterobacteria, E. coli included, is a gram-negative rod-shaped bacteria, facultative anaerobic, non-spore forming, and non-fastidious. E. coli can be peritrichous and motile, or one group of E. coli is non-motile and have no flagellae at all. In slice, it's appeared as a mono or diplobacillus, and clinical samples can be capsulated and have that rigid strong capsule. Usually, Enterobacteria, and the name initially was given because representatives of that family are found in intestine of human and animal. E. coli is the part of normal flora of bowel, perform multiple functions. It is a synthesis of different vitamins, digestion of nutrients, and actually E. coli is very important participant of human normal flora. The major part of bowel E. coli is found in is small intestine, and as far as bacteria facultative anaerobic means, it prefer oxygen and oxidation of carbohydrates. Bacteria consume oxygen which is dissolved in liquids or food in small intestine, and that way it provides anaerobic condition for large intestine flora, which is routinely obligate anaerobic. E. coli can help in protection against pathogenic microorganisms such as other pathogenic E. coli by release of multiple substances such as a colicine, and as well E. coli is confirmed by multiple studies in animals and actually observed in human as well. Stimulates immunity of the human by release of some substances in intestine, invasion in body, and release of lipopolysaccharide oil pairs, and overall immune response is significantly stimulated by normal flora E. coli. So bacteria is really important, perform multiple functions, and it is obligate to have that bacteria as the part of normal flora. So in nowadays, E. coli is the most famous microbe in scientific world. Any doctor knows what is it. In genetic engineering and bioscience, that bacteria is widely used. It is one of the most studied microorganisms. It was isolated in disease of every organ, of every tissue, and actually any purulent separative disease of human body can be caused by E. coli. Of course, I mean non-specific disorders, inflammatory infections of the skin and organs. A lot of experiments were performed initially with the help of E. coli. Genetic engineering still uses E. coli as the main bacteria. A lot of studies, experiments with bacteriophages performed with that bacteria as well. When technology of genetic code study was developed, E. coli was the first microorganism which genome was decoded completely. As well, that bacteria is used in epidemiology and in hygiene as indicate a microorganism which shows you contamination of soil, water, food products, and thanks to some genetic experiments and genetic studies, that bacteria nowadays is widely used in production of vaccines, some biological drugs such as insulin, and different experiments show good results, and nowadays again E. coli is still a very famous bacteria and widely used in multiple scientists. But of course, if you talk about E. coli, it's actually not one homogeneous bacteria. We combine multiple bacteria as one species E. coli because actually they are very similar for human, but in common structure and by multiple properties, bacteria is absolutely different. And of course, we can have normal flora E. coli, which is absolutely safe for us and even important. But we have pathogenic E. coli strains which can cause multiple disorders in our body. So if you talk about pathogenic E. coli, bacteria can have multiple factors of pathogenicity. Any E. coli, regardless of their group and structure, have lipopolysaccharide O antigen, which after destruction of the cell led to endotoxic effect and reduce activity of antibodies, protects against phagocytosis, and act as a toxin when invading human body. Again, some strains of E. coli can be capsulated, and that capsule acting as a K antigen provides protection against phagocytic cells and activity of system of complement in our body. Bacteria is surrounded by multiple fimbriae, which are used for adhesion to epithelial tissues, and of course without good fixation to our surfaces, bacteria cannot survive in intestine. And if it is pathogenic bacteria and even normal flora, fimbriae are absolutely essential for colonization of tissues and fixation to the surfaces. In diagnosis, those fimbriae can be used as a factor of agglutination of blood cells, and reaction of hemaggglutinations are based on presence of fibria as well. So we will talk about different pathogenic groups, and enteropathogenic E. coli can produce number of toxins, actually 4 different toxins. One is a head label toxin, which is known as LT or cholera-like toxin, and when released in intestine, the toxin can affect system of CEMP, increases outflow of water and electrolytes and the in the bowel, led to diarrhea. We have heat stable toxin or ST toxin, which have the same activity but another enzyme is affected, is GMP, and some strains can produce sugar-like toxin, or in some papers described as a verotoxin. It is a cytotoxin which can damage intestinal epithelium and lead to destructive changes. And yeast toxin, enteroaggregative heat stable toxin, which is similar to heat stable toxin acting on cGMP, but it's much less active. And the theory is that the toxin by itself have very weak activity and even maybe not active. But when the toxin is present in combination with other factors, virulent factors, it can provide significant damage to our intestine. So, common culture medium for cultivation of any enterobacterium is McConkie agar or endomedia. They are routinely used for diagnosis of enterobacteria, and if that enterobacteria is E. coli, you will have pink colonies, bright color, and sometimes even the whole agar around the colony became very pink. McConkie and endomedia contains lactose as the main sugar and indicator for acid. And as far as E. coli can utilize lactose with production of huge number of acid, colonies will have bright pink color, and in large amount acid will change the color of the whole agar as well. Blood agar sometimes can be used for growing of E. coli, especially if it is required to differentiate bacteria with some other, and bacteria will grow very fast, colonies will be large of white color. Very rare they hemolytic, but it is possible to have zone of hemolysis on blood agar, and saccharolite activity is present in large amount. For differentiation between enterobacteria and for confirmation of enterobacteria, the most frequently used agar is a Kliegler iron agar. It is a half slant, half tube agar which contains 2 sugars. In the slant part it is lactose, in the tube part it is glucose, and indicator for acid and H2S production is added. So in the case of E. coli, it will utilize both sugars, lactose and glucose, so the whole test tube will change color to yellow. Initial color of agar is red. Production of gas can be detected by formation of cracks in the agar, or very often if it is E. coli, then the whole agar is pushed up in the test tube. You can see that empty area between bottom of the test tube and agar. It is accumulation of gas pushing agar up. H2S is not produced, so black color will not be identified in the Kliegler iron agar. Of course, bacteria have very difficult antigenic structure. Actually, 3 antigens are possible. O antigen is obligate and present in any E. coli because it is cellular antigen. and H and K antigens are variable. If bacteria is non-motile, then of course H antigen will be absent, and not every E. coli is capsulated, so K antigen is variable as well. And according to different structure of different antigens, we have serogroups and serotypes of bacteria. So on that picture, serotyping or slide agglutination is provided. It is latex agglutination, and one of the most important serotypes of E. coli is O157H7. Later we'll discuss that serotype. And in that case, agglutination with specific type-specific serum is provided, and it is serotype O157H7 in the lowest part of the picture, and control negative result in the upper part of the picture. Again, in classic way, it is bacterial agglutination, but it's difficult to see because bacteria is transparent, and the right part of the slide picture of bacterial agglutination is provided, and again, there is a good picture and agglutination is easier to see. But in classes, when we perform that test, it's difficult because bacteria is clumping naturally and difficult to identify is it real agglutination, it is false result, and a lot of false tests are present. So nowadays latex agglutination with artificially colored antibodies are used, and it is easier to identify different antigens or H antigens and easier to evaluate the reaction. So immune serum is one of the most important ways to diagnose bacteria, not even identify E. coli. You can even estimate the group causing the disease. Of course, if you have a reaction of agglutination positive with K antigen, means that bacteria is capsulated, and it's easier to identify invasive strains of E. coli, what is not really possible in the case of biochemical identification. So in the clinical practice, we have several classifications of E. coli. First of all, of course, we have two major groups: community acquired strains and hospital acquired strains. In community, E. coli causing two main types of diseases. It is disorders of urinary tract infections and diarrheal infections. So our first group is known as UPEG group, urinary pathogenic E. coli, and second group is IPEG group. It means that intestinal pathogenic E. coli group. In hospitals and inpatient conditions, bacteria can cause again infection of any localization. Infections are non-specific and manifest by common separative disorder such as a wound infection, osteomyelitis, pneumonia, meningitis, and other. Not really possible to identify bacteria by symptoms because all symptoms are common for that type of the disease. But actually, again, any disorder which can be described in human can be caused by E. coli. Second group, important group of nosocomial strains, it is K1 strains or capsulated bacteria. Again, we have several modifications of K antigen, but in general, K1 group is most important because they can cause pyelonephritis as the complication of urinary disorder, and in neonatal kids, bacteria can lead to severe meningitis, which is difficult to treat, difficult to diagnose, and bacteria can easily invade into human body. So of course, main number of diseases caused by E. coli are non-specific and it's difficult to identify pathogen by symptoms. But we have important group of intestinal pathogenic E. coli or IP group, which is the most frequent group in human pathology. According to factors, number of factors of pathogenicity or viral infectors, all intestinal pathogenic E. coli are divided into 6 groups. And nowadays there are 6, but actually recently it was 5 groups. Maybe further studies will again change that classification, but still, till nowadays 6 groups should be described. First one, the most frequent, is enterotoxigenic E. coli or ETAC. That group of bacteria producing 2 toxins, heat-labile and heat-stable enterotoxins. Both acting on intracellular enzymes, bacteria have no factors to destroy human cells. Only exchange of electrolytes is affected, and actually diarrhea caused by that group of E. coli is watery without any blood or mucus, profuse in amount, and usually the diarrhea observed in people who change in location, means travelers, and common name of that type of bacteria in routine literature is a traveler's diarrhea or traveler's bacteria. So diarrhea is self-limited, usually not dangerous. In few days, disease will disappear by itself. Second group of intestinal pathogenic E. coli is an enteropathogenic. E. coli bacteria have several factors of adhesion and can stick to epithelium of intestine and form some type of microcolonies known as an attaching and effacing effect. In histopathological studies, those lesions are known as AE lesions. Bacteria affect, again, exchange of water and electrolytes in human body, usually absorbed in infants, while normal flora E. coli is absent. And diarrhea manifests by, again, watery profuse discharge with mucus but without any blood because cells are not damaged. Again, disorder is not severe, usually self-limited, or can be treated with some probiotics and common drugs. Third group of intestinal pathogenic E. coli is enter-invasive group. By name of that group, you can understand that bacteria have factors of invasion, and in clinical practice, that type of bacteria resembles Shigella and bacillary dysentery. That group of E. coli is non-motile and very inactive in biochemical activity. They are, again, resemble Shigella and causing disorder with destruction of human epithelium, led to common fever and diarrhea with blood, mucus, and leukocytes in fecal matter. That disease is more severe, can manifest with some pain in abdominal cavity, loss of appetite, and more severe symptoms than previous two groups. So as we said about that serotype of 157H7, it belonged to enterohemorrhagic group of intestinal pathogenic E. coli. That group of bacteria producing Shiga-like toxin. They have number of enterohemolysins, and again they can form the same AE lesions. That group of bacteria is one of the most dangerous because can lead to severe disorders, systemic disorders such as hemolytic uremic syndrome, and in next some slide I will show you that picture. Disorder in intestine usually manifests with severe abdominal pain, blood and feces, with high fever and leukocytosis. Fifth group is an enteraggregative E. coli, which have factors of adhesion to epithelium, and in histology study it will look like a pile of stacked bricks. And if that bacteria can produce head label toxin in combination with yeast toxin, as we said, that separate yeast toxin is low pathogenic factor, but when two toxins are combined together, and bacteria can have as well fimbria focalization of human intestinal tract, then disease will manifest with the low-grade fever, with watery diarrhea and mucus containing in the stool samples, and very often the diarrhea can manifest as a chronic illness, again observed mainly in kids with incorrect normal flora in intestine. Sixth group of bacteria was described recently. It is known as diffusely adherent E. coli. Again, studied poorly, but it is confirmed that bacteria have some important factors of diffuse adherence to epithelium. It's covered with multiple surface fimbria, and it can affect epithelium and exchange of electrolytes and water, led to watery diarrhea without blood or mucus and fecal matter. So, hemolytic uremic syndrome, one of the most dangerous complications of intestinal infections caused by E. coli. Actually, some other bacteria, enterobacteria, can lead to the disorder, as well. We will talk on further lectures. So the main danger of the disease is that it is a systemic disease. Bacteria can lead to damage of blood capillaries and endothelial cells over the body. And the most susceptible organ is a kidney, and the main damage and the major damage of that organ will lead to more significant clinical manifestations. So actually, you can observe triad of symptoms It is hemolytic anemia, thrombocytopenia, and acute renal failure. Usually, disease occurs after watery diarrhea caused by E. coli, manifests with abdominal pain and severe vomiting. Diarrhea starts as a watery, but a few days after, blood can appear and can be complicated with perforation and stenosis of the bowel. So the major disorder is damage of endothelial cells, and it will lead to fixation of thrombocytes on the surface of the cell and formation of thrombs. Containing of blood vessels blood vessels will be stenosed significantly and obstructed by those thrombs, and red blood cells, they will try to squeeze between those thrombs and they will be damaged, destroyed, and scratched, and it will lead to destruction of blood cells. Debris of cells will obstruct blood capillaries of kidneys even more than thrombs, and it will lead to severe ischemia and necrosis of kidney tissues. In general, it can lead to fatal outcome, especially if it is younger kids affected with that bacteria. So, of course, it's not really possible to have specific prophylaxis for E. coli diseases, because it is bacteria which is present in high amount in our normal flora, and we cannot eradicate that bacteria from our intestine because it is very important microbe in our body, producing multiple suitable functions. Prophylaxis is only non-specific, means then common hygiene measures, proper sanitation, no street toilets, washing hands, proper cooking, and etc. Main number of diseases not require any antibacterial treatment, because it is simple self-limited diarrhea which will ends itself without treatment. The only therapy you need to provide is a rehydration and compensation of lost electrolytes. Means in mild cases it is drinking of liquids, in severe cases you can give IV therapy, but again mainly it is only symptomatic. Of course, people will have some problems with digestion, you need to adjust proper diet. If it is required, then antibiotics can be used, such as ampicillin and cephalosporins. Usually E. coli is sensitive to common drugs, but if it is nosocomial disease and nosocomial disorder, of course bacteria can be multi-drug resistant, and in that case carbapenems or fluoroquinolones can be used for therapy of that disorder. What to do with the kids, young kids who have some disorder with E. coli? You cannot and you should not provide antibiotics, but you need to give something for therapy. We have one preparation which is known as a Coli bacterium, named by Escherichia coli. E. coli. It is a suspension of non-pathogenic E. coli, which can be used for therapy of intestinal disorders and dysbacteriosis in adults. It is part of E. coli which should present in normal flora. The key idea, if you will give normal E. coli, it will inhibit or even kill pathogenic bacteria by release of biological substances. And that therapy is very good, especially in kids when other drugs cannot be used at all. It can be used even for healthy people who have some problems with normal flora as a food supplement or some other purposes. So for today, that's all. See you next lectures. Bye bye.